Hey everyone, this chapter is going to go over what basic legal issues a health information professional would have to deal with in terms of information technology, especially as it relates to accreditation, licensure, and liability. Moving from paper-based to electronic health records has been good, right? It's improved the availability and the accessibility of data. It has saved space, but it also has increased the demands from external forces. So regulatory and accrediting agencies, insurance companies has, because they're able to access it more, have wanted to. Government efforts in healthcare reform, and it's helped to help avoid mistakes to reduce costs and improve care. Okay. The definition of a legal health record is the legal business record generated at or for a healthcare organization, whether it's paper-based, electronic, or hybrid. Paper-based records also include any correspondence or requests for release of information. Electronic health record systems can include master patient indexes or practice guidelines and prompts, but these are not part of the health record. The focus of the health record should be documenting what health services were delivered. So every healthcare provider has to define exactly what is included in their EHR. So it will vary from facility to facility, depending on what their specialty is. And it'll be patient-specific information that memorializes the patient's care. Okay. Any administrative data like audit trails or statistical reports or any aggregate data is not part of the legal health record. Okay, the state licensing board, authorities authorize the provider to practice in a specific state, whereas the accrediting organization sets standards for each provider's compliance, kind of like how they have to act. These two bodies govern the transition to electronic health records from paper-based. The federal government does not. All right. We've talked about ARA, the American Recovery and Reinvestment Act of 2009, which defines the electronic health record as a record of health-related information on someone that is created, gathered, managed, and consulted by authorized healthcare clinicians and staff, and includes demographic and clinical information. That would be like medical histories or problem lists. It has the capacity to provide clinical decision support, to support physician order entry, to capture and query information, relevant to quality. And then lastly, it's used to exchange and integrate electronic health information with other sources. Okay, recently the Institute of Medicine, IOM, identified the core functionalities that make up an electronic health record. Okay, so these are health information and data, results management, electronic communications and connectivity, decision support management, order entry and management, patient support, reporting and population health management, and administrative processes. Okay, so an issue here is if state law allows the storage of health information in an electronic format. Simply put, some address it and some don't. So it just depends. We've talked about this before. All entries in a patient's record have to be authored and authenticated. Electronic health records have made this a much easier process to get doctors to sign these records. So if your state allows the use of electronic health records, electronic signatures can be used to authenticate the record. Electronic signatures are also addressed by the Electronic Signatures in Global and National Commerce Act of 2001, also known as e-sign. They were very clever with that one. So this is a federal law dealing with the use of electronic signatures in international and national commerce. It says that electronic signatures cannot serve as a legal bar for contracts or other records. But accrediting organizations like Joint Commission and the Medicare Conditions of Participation definitely recognize authentication by electronic signatures. The healthcare organization just has to have a software program in place that makes the signature unique to the author, like a special pin or something, in order to meet the accrediting standards. The two main concerns with this in terms of liability or admissibility issues. So can an electronic health record be admissible and serve as proof in a lawsuit involving patient quality care? And then second, are safety and security of EHR. So liability from someone accessing a record that shouldn't be, or just careless handling of patient information. Okay, a health record, whether it's paper-based or electronic, cannot be admitted into evidence unless it overcomes the hearsay rule, which prohibits any out-of-court statement to try to prove the truth, okay? One way to overcome that is the business record exception. To use this, they have to show that the record was kept in the ordinary course of business, that it was recorded at or near the time of whatever it was that happened by someone that had firsthand knowledge, someone that was there or did the act, and that the custodian of records, the HIM manager, testifies about record keeping. The health information manager can be asked to testify to meet these requirements of the business record exception, and to explain how an electronic system works, how everything is recorded, and who can do so, and what security and quality measures there are. And then also they'll have to explain what they're admitting into evidence is a computer printout of the electronic health record, and just be familiar with what equipment was used to produce the printout and how reliable the software is and all that. Okay. So in an electronic context, security refers to the regulating of access to patient records, and the preservation of data. In the health information context, security would be considered breached or implicated if there is an interruption or discontinuation in a telemedicine session. So if you're doing basically like a Zoom with a doctor, if there's unauthorized access to the patient record, if patient information is destroyed prematurely, and if there's a privacy violation or breach of confidentiality. Okay, the security of a computer system is only as good as whatever measures are taken to safeguard it. Some of the most commonly taken measures are here: authentication, permission, encryption, damage prevention, and disaster recovery. Y'all can pause the video and read those. I don't want to read anything word for word for you here. Okay, Joint Commission, CMS, HIPAA, and state laws require healthcare providers to safeguard patient information. It's also addressed in the codes of ethics for every healthcare profession out there, basically. A breach of duty in this will more than likely result in a liability claim for one of these reasons: breach of confidentiality, invasion of privacy, defamation, or negligence. We also have to worry about the physical security of these computer systems so that they're protected, right? That, the physical computer is not getting too hot and overheating. That if there's like a power surge, that it doesn't impact the computers. Fire alarms and fireproof location. What happens if the building catches on fire? Rules limiting access to terminals, like computer terminals and storage, locked cabinets, maintenance requirements, and logs maintained. Okay. And then also personnel security. Humans are naturally curious, so it's important when you're hiring new employees to reference background checks associated with hiring, okay, criminal background checks. See if they have a history of security problems or computer hacking. Educating them on confidentiality policies. Setting your expectations for proper computer access. Like, it can be written in the employee handbook, but to make sure it's stated, this is what is expected of you. Limited access to information, signed acknowledgement of receipt of education, and disciplinary action for violation of the policy. Okay. All right. A lot of the risk prevention techniques cover both physical and personnel security issues to try to maintain confidentiality. So these techniques are used to create policies and procedures for the computer systems and the personnel that use them. So some of these would include restricting access, determining who has access and for what purpose, having computer passwords, key cards, IDs, restricting copying functions, putting security mechanisms in contracts with outside computer service bureaus, establishing confidentiality agreements among network participants, addressing the potential for computer sabotage, and safeguard use of laptops and PDAs. That's like personal devices. Because a lot of facilities use third-party computer service bureaus to store patient data, HIPAA and ARA both address the business associate rule, which requires any contracts with business associates or third parties to include the confidential nature of the data, what mechanisms are to be used to safeguard it, and indemnification if there's an improper disclosure, just so that you're covered. And it's sometimes overlooked, but this also applies to any laptops, flash drives, iPads, okay, all of those things as well. And kind of like, I think from the case study for, actually, no, I think I turned that into practice. So describe. If multiple physician groups are on the same network, then there should be some sort of confidentiality agreement that would say, you can't access my patient's information and I can't access yours, okay? Because really there's no reason for them to be able to do that unless they're both treating a patient. And then lastly, risk prevention techniques should also address computer sabotage, which usually takes place because of like a disgruntled employee or someone putting a virus on a computer that can alter or destroy the data or cause the computer to crash, okay? Okay, HIPAA security rule establishes these security safeguards. And I'm sorry, guys, this is just a lot of lists reading from slides. To protect confidentiality of data, to ensure data integrity, and allow data to be available when needed. There are 17 different security standards. They specify the use of integrity controls, encryption technology, information access techniques, permission levels, and access controls. These 17 standards fall under administrative, physical, and technical safeguards, okay? So the administrative safeguards manage the development, implementation, and maintenance of security measures to protect PHI. So through policies and procedures, these focus on prevention, detection, containment, and correction. Risk assessment of security practices have to be done. How PHIs access, where are they vulnerable, monitors the users, like changing passwords every 3 months or something like that. The physical safeguards protect electronic information systems. Okay, so think physical, like things you can touch and see. Focus on the systems, facilities, and equipment. Restrict individual access to facilities that house information systems. Establish access levels to physical space based on a person's role or function. And establish disposal policies and procedures for tapes, storage devices, and then other equipment. And then the last one is technical safeguards. So employ technological solutions to secure electronic PHI. Focus on technology to limit unauthorized access and ensure data integrity. Employ encryption technology for email. Examine activities on the computer network. And assign unique identifiers to end users to track their system use. Okay. The security rule also talks about what training requirements there are for staff. It doesn't specify what the training should be, but some sort of program on basic computer security for every employee and any contractors. And as you would have guessed, the facility has to document that the training was provided and periodically update the program. The security rule also requires that the facility establishes information security policies, which define the framework for the security program. So these policies answer the who, what, where, when, why, and how questions of information security. Okay, so we've been talking about the security rule today a lot, but the privacy rule also serves to protect data from unauthorized uses or disclosures. Let me just take a step back for a second, because I know we talk about the HIPAA privacy rule and the HIPAA security rule. So what's the difference? The HIPAA privacy rule focuses on the right of the individual and their ability to control their PHI. So the physical security and confidentiality of PHI in any format, paper, electronic, even oral. The security rule only deals with the protection of electronic PHI, and it's more the technical requirements. Both rules give this responsibility for compliance to someone in the facility, so either the security officer or the privacy officer, okay? A breach is defined as the acquisition, access, use, or disclosure of protected health information, PHI, in a manner which compromises the security or privacy of protected health information. If a facility finds out there's been a breach, they're required to perform a risk assessment to figure out if PHI has been compromised. Okay, so they're asking, what was the nature of the PHI involved? Was the user unauthorized, or did they have authorization? Was it the PHI actually acquired? Did they take it, or was it just looked at? Has risk to the PHI been mitigated? Okay, they're required to notify anyone of the breach. Let's see. But if it's higher, they're required under the omnibus final rule to notify the patients affected. Okay, there are a lot of electronic tools now that everyone uses regularly to conduct business, but they raise a lot of legal concerns when it comes to privacy and security of patient-related information. So things like the internet, email, texting, digital imaging, and telemedicine. So let's get into each of these. Doctors and patients both use the internet to look up things regarding their care or different conditions. In some places, like those e-health organizations where you can communicate with the nurse or doctor and check out all your lab work and everything. Any patient that participates in e-health is known as an e-health consumer, and all the same safeguards in place are in place to protect your PHI in a typical healthcare setting is applied to this information as well. The use of email and texting has become a lot more popular in the healthcare field as well. These types of communication should never be considered private because the email can be stored and reviewed by people other than the recipient if they were to forward the email, right? And again, all of the same laws and regulations on privacy from HIPAA, Medicare, Joint Commission also apply on this form of communication, but again, it can be easily shared. On top of the legal requirements, each healthcare organization should have a plan in place regarding email and texting as forms of clinical documentation and how it relates to patient confidentiality, about what would be considered permissible, and any encryption that should take place. Okay, digital imaging works sort of like a copy machine where it scans in paper health records to a disk or CD and then can be viewed by anyone who needs to access it through a web browser or through the server. Some states have created laws dealing directly with digital imaging, talking about confidentiality and security. Another big or newer thing is telemedicine, which is defined as the use of electronic communications and information technologies to provide or support clinical care at a distance. This has been really good for people that don't live very close to the doctor they need to see, or for patients that are homebound that can't regularly go in to see their doctor. One of the reasons telemedicine has not advanced more rapidly, though, is because there are a lot of unresolved legal questions when it comes to privacy, licensing, and medical reimbursement, especially when it comes to a patient in one state seeing a doctor in a different state. Which state laws apply? Or what happens if there's a technical failure and they lose communication and there's some sort of injury? Could the physician be held liable? Okay, things like that. And because there is always some sort of new technology, there will be legal questions that come up that haven't been considered yet, okay? One of the biggest concerns is safeguarding and protecting patient health information when new technology comes about to store or transmit data. For example, would it be okay to store patient health information in the cloud? No, definitely not. Okay, so there's going to continue to be, evolving issues. Other examples of new technologies would be like blockchain, which is mostly used in the financial world, but has been in talks of wanting to be used in the healthcare field. Or there's nanobots, nanomedicine. Nanobots are like microscopically small robots that they use to travel through the capillaries of the brain to target specific cancer cells. The last example is CRISPR, which has to do with with genetic material, which we all know there's a lot of privacy questions around that. But this is a genetic engineering technique where they can snip or edit genes to alter the composition of the organism. So this definitely raises some ethical questions as well. And the last big ethical issue with the internet and the availability of information in healthcare is known as the digital divide. This is the gulf between those who have access to and those who do not have access to modern information and technology like smartphones or computers and the internet. It also exists in the healthcare field because some smaller entities can't afford to make investments in newer technologies while some can. So you could use some of those ethical concepts we talked about when talking about this digital divide, like utilitarianism, deontology, and justice. Okay, that's it for today. Let me know if you have questions, and I'll see y'all next time.